Therapeutics aren't just being hampered by small supply. Some doctors say the lack of getting test results in a timely manner is also an issue. And also, some hospitals say staffing shortages limit their ability to provide monoclonal antibody infusions. And we do have some news that should give you a small glimmer of hope in the battle against COVID. The Omicron surge seems to actually be slowing down in some East Coast cities, particularly in New York City, which is the epicenter of the wave in the country. And that's why we're bringing in Dr. Sujan Gogu, a family sports and pain medicine expert, to discuss that and the latest on all things COVID. Good to see you again, Dr. Gogu. We've had some bad news, but a little bit of good news here. The Omicron surge seems to be slowing down. What can you tell us about this? Is it too early to get excited, or is this a good sign?
No, I think it's still pretty early, but I think if you just look at South Africa and look at Europe, we're seeing cases going down there. And typically, the United States typically follows that same trend. Obviously, there's parts of the country like the Northeast where you're seeing cases slowly going down, but there's still vast majorities of this country that the rates are still going up. And so I still think we have a few more weeks before we can really say we're hopefully in the clear.
And there's also some other promising news. A new study shows that the use of cannabis can prevent COVID-19 from penetrating human cells. Is that something that people can really rely on, or is that something that's still sort of in the test stages?
Yeah, I definitely think this is still in the test stages. The cannabinoid receptors are a huge source of study right now in a multitude of different areas. And it's interesting that we're seeing that they could be linked to COVID-19 prevention. We still need more data and more studies before we can really find a proper way to dispense this. But I'm hopeful that we find many different types of therapeutics, including looking at cannabinoid receptors.
Now, officials around the world have hoped that Omicron's high transmissibility and relative lack of severity would help transition COVID into a more manageable endemic disease rather than calling it a pandemic. Do you think we're close to that?
I don't think we're close to that yet. I do think at some point we will get there. The hope is, Omicron or COVID, it ends up just becoming a plain, simple upper respiratory virus that we have. We have several circulating upper respiratory viruses even right now, like adenovirus. We have RSV, we have the flu, and so forth. And hopefully, COVID becomes one of those. And I do think it will hopefully get to that point. But I still think we're far away from that point because we have a lot of people that are still getting severely sick, and we're still having 1,000+ people die a day. So we're nowhere close, in my opinion.
But what about people who say, we're getting used to this, it's not like 2 years ago when everybody was in such awe of what was happening and people are getting used to it. They're saying it's almost like, okay, we have to deal with the flu every year. Now we have to deal with these different strains. Why is this different than just a flu?
Yeah, so I think the big difference is when people get the flu, typically they get sick for 7 to 14 days, and then they're back about doing what they normally do, with no long-term concern of having any health problems down the line. I think with COVID, there's still so much unknown. We're seeing that people that do get COVID or catch it, there could be long-term sequelae of long COVID that they are experiencing. And this is not for everybody, but there is a group of people that are experiencing some of these symptoms. Some people are losing their taste, some people are losing their smell, some people still don't have the respiratory capacity to their fullest. We're seeing some children that we're still learning, what is the impact of COVID on their mental health? What is the impact on them developing type 1 or type 2 diabetes down the line? And so we just don't know enough to say that there will be no impact down the line. But I think in the short term, I think people are looking at it and saying, well, I'm not having any problems. The majority of people, but there is still a group of people that are getting long COVID, and there's still potential for this causing problems down the line in terms of chronic disease that's very different than what we're experiencing right now.
Yeah, that's a good point. And in terms of travel, is it still a bad time to be traveling, especially if you're going abroad, maybe Europe, India, China even? Is this still a bad time to be moving about?
It's you have to make, sensible decisions. And I think, you have to weigh the risk of, what chronic diseases you have, what medical condition you are in as an individual, and the necessity of that trip. And I think those are risks that you have to take upon yourself. But, I think Omicron, in vast parts of the world, some countries it's on the downturn, some countries it's on the upturn. And so it depends on a multitude of different factors.
Well, as always, Dr. Gogo, we appreciate you joining us with the latest because it just changes all the time. We try to keep on top of it. Thank you so much for being with us.
Thank you.
And we have more breaking news for you. 11 members of the Oath Keepers